A 71-year-old patient came to my office feeling proud. Doctor, I've been exercising my penis every day religiously for 6 months. When I examined him, what I found concerned me. He was doing everything correctly with discipline and enthusiasm, but his body was paying a price he hadn't even imagined. And worst of all, he thought he was helping himself. And look, before you think I'm against penis exercises, I'm not. On the contrary, in my previous video on this topic, I showed exercises that really work and thousands of you watched and put them into practice. I'm thrilled about that. But then a question started appearing in the comments, one after another. Doctor, can I do it every day? And if I do it more times a day, will the results come faster? That's when I realized I needed to record this video urgently. My name is Dr. Fernanda Arruda. I'm a urologist with over 15 years, dedicated to men's health here in Brazil, especially for men over 60. And today I'm going to clearly show you what really happens in your body when you exercise your penis every day. Are there good things? Yes, but there are things no one is telling you that can make the difference between strengthening your body or harming it without realizing it. Stay with me until the end because what I'm going to reveal here could completely change the way you take care of this very important part of your health. And tell me in the comments, do you already practice any penis exercises? I want to know how your experience has been. Now, before talking about the risks, I need to be fair because penis exercises bring real benefits. And if you've already started practicing, your body is probably already thanking you. Let me explain what good things happen in the first few days. When you start doing penis exercises correctly, the first thing that happens is an increase in blood circulation in the area. It's like opening a faucet that had been half closed for years. Blood starts flowing more forcefully to the corpora cavernosa, those internal tissues responsible for erections. And with more blood arriving, the tissue gets better oxygenated, better nourished, and starts responding with more firmness. Many of my patients report noticing a difference in the first 2 weeks. Morning erections return more frequently. The penis seems fuller, even at rest. And there's a sense of vitality they hadn't felt in a long time. This is real, it's physiological, and it's a great sign. Additionally, these exercises activate the pelvic floor, that group of muscles that supports everything down there. With it stronger, you gain more control over erections, ejaculation, and even the bladder. It's like renovating the foundation of a house. Everything on top works better and lasts longer. When you see these results, something powerful happens in your mind. Confidence returns. You feel more alive, more present, more capable. And this overflows into relationships, mood, and daily life. So far, everything is wonderful, right? But it's exactly at this point that most people make a dangerous mistake. And that's what I need to warn you about now. If you've already felt these initial benefits, comment below what changed for you. Your experience could help another man who's still unsure. And this is where most men fall into a trap. Because when you start feeling the results, the natural thought is, if doing a little works so well, doing it every day must be even better. It seems logical, right? But your body after 60 doesn't work that way. And I'm going to explain exactly why. Think about it. When you go to the gym and train your arms with weights, what does the instructor say? Rest a day before training the same muscle, because growth and strengthening don't happen during the exercise. They happen during rest. It's in recovery that the tissue repairs, strengthens, and adapts. With the penis, it's exactly the same. The penis tissues are delicate, especially after 60. When you do exercises, you're creating microstimuli in those tissues. In the right doses, this is excellent. The body receives the stimulus, rests, recovers, and comes back stronger. But when you don't give it that recovery time, when you force it every single day without stopping, the body can't keep up. And here's the problem no one talks about. After 60, the body's regenerative capacity is naturally slower. Collagen takes longer to rebuild. Blood vessels are more fragile. Nerves respond more slowly. So, what might have been tolerable at 30 could become a silent overload at 65 or 70. It's like driving a classic car on a dirt road every day without maintenance. It works for a while, but inside, the wear accumulates, and when the problem appears, it's already advanced. But how do you know if you've crossed the limit? The body always gives signs. And that's exactly what I'm going to show you now. Tell me in the comments. Do you practice these exercises every day or take breaks? I want to know how you've been doing it. That 71-year-old patient I mentioned at the beginning was feeling some of these signs for weeks but ignored them all, thinking it was normal, that it was part of the process. It wasn't, and I don't want the same to happen to you. So pay close attention in the next few minutes. The first sign is numbness. If after doing the exercises you notice that the penis sensitivity has decreased, that touch isn't the same, this is the body crying for help. It means the nerves are being overloaded and need urgent rest. The second sign is pain, and I'm not talking about mild discomfort during the exercise. I'm talking about pain that lingers afterward, that appears hours later, or that returns the next day. Any persistent pain in that area is a red alert that should never be ignored. The third sign is the most treacherous of all. Erections start getting weaker, not stronger. You're exercising precisely to improve, but you notice it's worsening. This happens because the tissue is inflamed, micro-injured, and instead of strengthening, it's weakening. It's the exact opposite of what you wanted. The fourth sign is the appearance of dark or purple spots. This indicates that small blood vessels are rupturing. It might seem minor, but over time, these injuries can form internal scar tissue, which hardens the penis incorrectly and can lead to abnormal curvatures. And the fifth sign is swelling that shouldn't be there. If after the exercises you notice any kind of swelling that takes time to disappear, stop immediately. If you identify with at least one of these signs, tell me in the comments. No shame at all. This is a safe space, and your experience could alert another man. But look, the visible signs are just the surface. What really worries me as a urologist is what's happening inside, where you can't see or feel it immediately. I'm talking about your prostate and your pelvic floor. And what I'm going to tell you now surprises even doctors. When you exercise your penis every day without rest, the entire pelvic region enters a state of constant tension. The pelvic floor, that set of muscles that supports the bladder, prostate, and sexual organs, can't relax. And a muscle that never relaxes isn't a strong muscle, it's an exhausted one. I've had patients come in complaining of weak urine stream, dribbling after urinating, a strange feeling of heaviness in the area. When we investigated, it wasn't an enlarged prostate. It was a locked up, hypertense pelvic floor from being overworked without rest. And most concerning, they had no idea the exercises were causing it. Now, about the prostate. When there's chronic tension in the pelvic region, circulation around the prostate gets compromised. Blood doesn't flow as it should. Prostatic fluid can start to stagnate, and this stagnation creates a favorable environment for inflammation. Over time, this can evolve into prostatitis, which is prostate inflammation, bringing pain, urinary discomfort, and even fever in more serious cases. And look, I'm not saying this to scare you. I'm saying it because the solution is simple. It's just respecting your body's time. Rest isn't laziness, it's intelligence. It's letting the body do its part. But then comes the question everyone asks me, Doctor, so how many times a week is ideal? Is there a right number? The answer might surprise you. Tell me in the comments, have you ever felt urinary discomfort and never associated it with the exercises? This is more common than you think. This is by far the question I get most in comments and consultations. Doctor, give me a number. How many times a week can I do it? And I understand this anxiety because when no one gives you clear direction, you're left in the dark. So now I'm going to give you that direction. For men over 60, what I recommend based on my clinical experience and what studies show is the following: 3 times a week with a day of rest between each session. This gives the body enough time to receive the stimulus, recover, and come back stronger. It's the balance between doing enough to get results and not exceeding the body's limit. But pay attention, it's not just about how many times. It's about how you do it. Each session doesn't need to be long. Between 10 and 15 minutes is sufficient. More than that, you're forcing it. And forcing, as we've seen, doesn't accelerate any results. It only accelerates problems. Another fundamental thing is intensity. Penis exercises aren't a competition. There's no trophy for squeezing harder or doing more reps. The movement should be firm, yes, but never to the point of causing pain or discomfort. If it hurts, you've gone too far. Simple as that. And there's something almost no one talks about: warming up. Before any exercise, warm the area with a warm towel for 2 or 3 minutes. This opens up circulation, prepares the tissues, and greatly reduces the risk of injury. It seems like a small detail, but it makes a huge difference. So remember, 3 times a week, 10 to 15 minutes, moderate intensity, always with warming up. That's the formula that protects and strengthens at the same time. Now that you know the right frequency, you need to know which exercises really work and are safe. Because doing the wrong exercise, even at the right frequency, can still harm you. Tell me in the comments, did you already have a defined routine or were you doing it without a clear plan? Most men I see didn't, and that makes all the difference. Now comes the part I know many of you have been waiting for since the beginning: the exercises themselves. Which ones are safe, how to do them correctly, and what you should never, under any circumstances, try. Pay attention because a mistake here can be costly. The first exercise is the male Kegel. This is the king of pelvic floor exercises. You contract the same muscle you'd use to stop the urine stream. Hold for 5 seconds, relax for 5 seconds. Do 10 repetitions. 3 sets. It seems simple, but the effect is profound. It strengthens the pelvic floor, improves erection control, ejaculation, and even bladder control. And the best part, you can do it sitting, standing, lying down, without anyone noticing. The second exercise is gentle stretching. With the penis at rest, hold the head with gentle firmness and stretch forward, holding for 15 to 20 seconds. Then repeat to the sides and downward without pain or excessive force. This movement helps maintain the elasticity of the internal tissues and promotes circulation. 3 repetitions for each direction is enough. The third exercise is base compression. With the penis semi-erect, form a ring with your thumb and index finger at the base and slide gently toward the glands with moderate pressure. This stimulates blood flow to the corpora cavernosa. Do 10 to 15 repetitions, always with water-based lubricant to avoid any skin friction. Now, what never to do? Never use weights hanging from the penis. Never use improvised homemade devices. Never do abrupt or twisting movements. These practices can cause very serious injuries, from vessel ruptures to Peyronie's disease, which is the formation of fibrous plaques that permanently curve the penis. If this video is helping you better understand how to take care of your body, comment below which of these 3 exercises you're going to start practicing. I read all the comments. Before you leave this video, I need to tell you something that goes beyond exercises, techniques, and frequency. Something that after 15 years in practice, I consider the most important of all, and that maybe no one has ever told you. Your body deserves your care. Not just any care in a rush or on autopilot, but conscious, respectful care. From someone who understands that this body has brought you this far, has carried you for decades, has faced things only you know. And it's still here, functioning, responding, just asking you to pay attention to it. Many men I see carry a silent guilt. They feel that taking care of this part of the body is wrong, something that doesn't fit with their age. But I tell you with all the certainty of my experience, taking care of your sexual health is taking care of your overall health. It's caring for the heart, the mind, self-esteem, the will to live. You don't need to have the body of your 20s. You don't need to compare yourself to anyone. You just need to respect your own rhythm, follow the correct guidelines, and have the awareness that every stage of life has its own strength, its own beauty. That 71-year-old patient I mentioned at the beginning, after we adjusted the frequency and technique, came back to the office 3 months later with a smile I hadn't seen before. He said that not only did his body improve, but he felt in control of himself again. That's priceless. So if this video made sense to you, subscribe to the channel and turn on notifications. I post content every week designed especially for men who want to age with health, strength, and dignity. Share this video with that friend you know needs to hear this. And tell me in the comments what you learned today that you didn't know before. I read each one and respond whenever I can. A hug from Dr. Fernanda, and see you in the next video. Take good care.